and gentlemen, Dr. Agus Setiawan will present his material entitled Strengthening Interprofessional Practice in the Primary Care for Better Global Health. University of Nursing, Universitas Indonesia. And then from 2000 until now, he is in Department of Community Health Nursing, Faculty of Nursing, Universitas Indonesia. And Dr. Agus finished her doctoral degree in University of Technology, Sydney, Australia. And he has some professional organizations. One of them is as advisory board in Association of Indonesia Community Health Nurses. And he also has got some synergistic activities. From 2018 until present, he's a contributor and editor in Elsevier Books and Learning Resources, as well as the reviewer for some journals. And he also has got so many scholarships and grants and awards. One of them, the latest one, is a research grant from Universitas Indonesia. And he also has got some selected publications, and the latest one entitled Resilience-Based Islamic Program as Promising Intervention on Diabetes Fatigue and Health-Related Quality of Life. Okay, Mr. Agus, are you ready to present your material today?
Yeah. Thank you.
The screen is yours. Thank you.
Okay, how long do I have for this presentation, Ibu moderator?
30 minutes, please.
Okay, yeah, thank you very much, Ibu moderator, for a very nice introduction. Good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh. The Honorable the Director of Poltekkes Kemenkes Bengkulu and all the faculties and also the students. First of all, I'd like to congratulate Poltekkes Kemenkes Bengkulu, who have successfully conducted the 2022 Bengkulu International Conference on Health. And thank you for having me in this session. Thank you for the invitation. It is indeed an honor for me to be able to be here speaking about interprofessional practice and interprofessional education. I apologize that I cannot come in person to Bengkulu for some reasons, and hence I am going to deliver my presentations virtually. Allow me to share my screen. Can you see my screen? Yeah, okay, I assume as a yes, yeah. So the topic that I'm going to talk this afternoon is aligning with the theme of the conference, strengthening interprofessional practice in the primary care for better global health. I will start with the trends that the world is facing today. Then I'm going to highlight one of the mega trend, which is aging population, and what the implications are and how it influences the health in the community. And then also I'd like to highlight the complexity of healthcare that we are dealing today, and the importance of interprofessional collaboration. And I'm going to give you an overview about the interprofessional education that we are conducting here at Universitas Indonesia. And I will end up with conclusion. So let me start with megatrend. Megatrends is basically the terminology in economy. So basically megatrends is the definition of describing how the world will look like tomorrow in the future. Basically in 2045, Indonesia will be facing the 100 of its independence or anniversary, and the government has highlighted at least 10 the trends that we have to anticipate. So I would like to highlight 5 of them. The one that closely related to our area, which is in health. The first one is global economic power, as we are experiencing the biggest pandemic in the last 100 years after we had one back in 1920 in Spanish flu, which killed about 50 million people in the world. Now we have the second biggest one back in starting in 2020, and now the pandemic has influenced to the crisis of health. Not only the crisis of health, but also influence the crisis in economy, and now start to the crisis in geopolitics. As we might be aware that there are some tension in some part of the country in the world, like Russia and Ukraine, and now between China and the surrounding areas, and so on. And the second trend that the world need to anticipate in the future is the change in demographic. As the world is getting older, the populations, I'm going to show you the figure in a minute. And then the rise of technology. As we know that today, technology is rising very rapidly. In the past, it used to be between one invention into another invention, took about 100 of years, 10 of years, but now nearly every day we got new technology. So the point that I'd like to highlight from this trend, particularly in the rise of technology, is that what we are teaching to our students today might not be relevant when they graduate, as there will be new technology. So the competency that we have to highlight, we have to emphasize to our students.
Jadi uniru banget po nih kontak darurat tuh.
The competency of or the capacity of learn how to learn, how to be adaptive to rapid change, to new technology. And the fourth one is rapid urbanization. As in the world, 95% of the population will be living in the city, and 65% of the community will be living in the city, and 95% is happening in the low and middle income countries like Southeast Asia and Latin America. So one of the consequences of this is in the multi-distribution of health workers, as been mentioned with by the previous speaker, and also the climate change as we are experiencing today. In the past, we have quite regular climate throughout the year. We can predict between September, October, November will be raining season, and then between September to April will be dry season. But now it cannot be predicted very clearly, as the climate change very significantly. Now, allow me to highlight one of the issues in megatrends, which is aging population in the world. So between 2015 and 2050, the proportion of the world population over 60 years will nearly double from 12% into 22%. In 2020, the number of people aged 60 years and older will outnumber children younger than 5 years. I'm going to show you in the next slide. In 2050, 80% of older people will be living in low and middle income countries like in Southeast Asia. And the pace of population aging is much faster than in the past. And in Indonesia, one of the country that experiencing the rapid change in the number of aging population. And all countries face major challenges to ensure that their health and social system are ready to make the most of this demographic shift. So this is the fact that I mentioned in the previous slide, that in 2020, there is an interchange in the number of older population and younger population, where older people will outnumber the children under 5 years old. And in the future, in 2050, even about 20% of the total population will be those who are at 60 years old or above. So this is about the aging population here in Indonesia. So there are nearly 10%. So if in this room we have about, let's say, 300 participants, then 30 of us will be over 60 years old. So there will be 50-50 between older people who are living in urban and rural area, will 8.5% in light elderly, with more female than male. So what are the impact of aging population on health? As we can see here in the figure 28 and 2030, as you can see, there are three different group of countries. The left one is high income countries, the middle one is middle income countries, and the right one is low income countries. In high income countries, there is no significant difference in the between 2008 and 2030 in the number of non-communicable disease, communicable disease, and also injuries. But if we see in the middle income country and low income countries, there is an increase in the number of non-communicable diseases between 2008 and 2030. Yeah, so more communicable, non-communicable disease compared to communicable maternal, perinatal, and nutritional conditions. I guess this is one of the impact that the life expectancy of the population in this country increased significantly. Now let's take a look at the health challenges that we are experiencing here in Indonesia. Life expectancy is over 33 years, with some statistics in the health indicator like maternal mortality and infant mortality. We have 206 per 100,000 live birth, with infant mortality ratio 23 per 1,000 live birth. We are performing quite good in terms of infant mortality ratio. We have reached the target of Millennium Development Goals back in 2015, but we have still homework in the number of maternal mortality ratio. With cause of death are mostly non-communicable diseases like stroke, ischemic and hypertensive heart disease, and also diabetes. And the health challenge that we have to deal with at the moment are still access to healthcare, as Indonesia is very diverse in terms of geographical situations, and not every provinces, every cities, every villages are staffed by health workers. And also universal health coverage. Universal health coverage, not every Indonesian people are covered by health insurance, and also emergency and infectious diseases that we are experiencing in the last 3 years from 2020. So this is the complexity of healthcare, particularly as the result of the number of population with the aging populations. So the healthcare is complex, due to the diversity of tasks involved in the delivery of patient care, the dependency of healthcare providers to one on another, the diversity of patients, clinicians, and other staffs, the huge number of relationships between patients, carers, healthcare providers, support staff, administrators, family and community members, the vulnerability of the patients, variations in the physical layout of clinical environments, the variability of lack of regulations, implementation of new technology that might take some time to actually adopt it in the service, the diversity of care pathways and organization involved, and increased specialization of healthcare professionals. While specialization allows the wider range of patient treatments and services, it also provides more opportunity for things to go wrong and errors to occur. So this is some of the commitment of the Ministry of Health in undertaking transformation in health system. I'm sorry, this slide is in Bahasa, but I'm going to translate it for you. So basically, there are 6 pillars in the health transformation that initiated by the government. The first one is transformation in primary care. The second one is the transformation in rural or secondary care. The third one is the transformation in health system resilience. The fourth one is the transformation in health insurance and financing. The fifth one is the transformation in human resource for health. And the last one is the transformation in health technology. So after looking at the complexity of health problems and the fact that we have aging population with more complicated health services, now let's take a look at the importance of interprofessional practice in the primary care. As one of the consequences of aging population is we need more long-term care in the community. Yeah, not in the secondary care, not in a hospital, but in the community. And high elderly population will be national burden if the elderly suffer with health problems. So has high demands of comprehensive care. And effective team-based healthcare through interprofessional collaboration among healthcare can improve the quality of care and patient outcomes, patient safety, and staff morale while decreasing hospital admissions, length of hospital stays, and staff turnover. So this is basically the definition of interprofessional collaborative practice. As multiple health workers from different professional backgrounds work together with patients, families, careers, and communities to deliver the highest quality of care across settings. So what are the benefits of interprofessional collaborations? So it can improve access health intervention and improve coordination between different sectors or individuals and their families with more involvement in decision making. A comprehensive, coordinated, and safe health system that is responsive to the needs of the population, efficient use of resources, reduce incidence and prevalence of disability, and also increase job satisfaction with reduced stress and burnout of health professionals. So these are the key enablers of interprofessional collaborations. Leaders and champions. So we need commitment from the leaders and key stakeholders. We need support from administrative, institutional work culture. We need mentorship and learning. As we adopt a new framework system of interprofessional collaboration, we need sometimes to learn to do new system. We need to have shared vision and mission. That the vision set by the organization is not only for the directors, not the high level of management, but it's also shared vision that should embedded into all the members of the organization. And also we need support in terms of physical environment and space design. So this is the one of the framework in team building model, stipulating the goals of team building, which include goals, roles, process, and relationships. So basically in interprofessional practice, the goals should be very clear direction, shared values, and sense of purpose. We need to define the responsibilities, clear rules for working together. We need clear communication, decision-making authority, and also dispute management. And also there will be a need for interprofessional relationships. There will be trust, mutual support, and also genuine friendliness. So in contrast to the benefits, there are also some barriers that we have to anticipate when we implement the interprofessional practice approach. This involves in professional cultures and stereotype, inconsistent use and different understandings of language, since we come from different background, accreditation and curricula, which is different between one discipline to another, and knowledge of the roles and scope of other health professionals. So for us in Universitas Indonesia, we have implemented interprofessional educations, and some of our staff has conducted some research on interprofessional practice. One of our staff from the Faculty of Medicine have done a study on thematic analysis result from focus group discussions in primary health centers in Depok City, and they come out with 5 themes in professional practice in the community, which includes structure of interprofessional collaborative practice, supporting factors, inhibiting factors, what perceived benefits from the practice, and also challenges and interprofessional collaborative practice in the primary healthcare settings. And these are some studies that we can see in the articles and journals about the benefits of interprofessional practice in the community, and also some studies that maybe some of the studies we can take and adopt to implement in our context. So these are the importance of international practice to address the complexity of healthcare, particularly in aging population, and as mentioned earlier, where patient and family as the focus, and there are interprofessional care and education that involve a family physician, resident physician, pharmacist, dietitian, psychotherapist, occupational therapist, social worker, community nurse, and perhaps more than health workers that mentioned in this model. So care that is provided by an individual health professional to patients or community members is never as good as care provided by highly functioning collaborative system. So this is the model that we developed in Depok City. We had collaboration between Depok Health District Office and Faculty of Nursing Universitas Indonesia. We developed what we call nursing center. In nursing center, we have a center that involve the activity, integrate the activity of teaching, learning, research, and the care service. So basically, patient, when they come to Puskesmas, they will go to the clinic like clinic umum, general, KIA, MJH, nutrition, adult, lansia, older people, and so on. So after they come to the service, they will have usually they go home or they will refer to hospital. But since there is nursing center, there are some patients who are at risk, who, for example, they come quite frequently to Puskesmas. We need to find out why this happened. Then before they go home, they will be follow up in nursing center. So the community nurse will do assessment in the center, and they will be referred to the community to do some intervention at family, like home visit. They do family care, and then there are some supporting groups that are available in the community that can help them with multidisciplinary approach. So we had done some study on the quality care in the primary care since we conducted the model. It involves 6 puskesmas in Depok City with method interview with 12 health workers and survey on 540 patients, and the result, most of the patients satisfied with the cares, while the health workers highlighting the importance of one's role coordination as key factor and care quality, and also they highlight some suggestion for better practice in the future. And this study has been published in the Q2 Scopus journal. So we need the global competence for health professionals, particularly in the era of disruption following the COVID-19 pandemic. We want our graduates not only capable for professional knowledge, attitude, and skills, but we expect that they will have more competency like data literacy, technology literacy, cultural literacy, and also the most important thing is interprofessional competencies, where they can work together. So when we talk about interprofessional practice, it will be very close to interprofessional education to support interprofessional collaboration. So basically, interprofessional education occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcome. I'm going to show you the example that we have implemented here in Faculty of Nursing Universitas Indonesia in health cluster. So this is the model that we use from WHO, where collaborative practice is important. Before that, we need to do interprofessional education. So we have healthcare reform and transformation. There will be a need for education. So the care will be effective and efficient. It can be done by interprofessional collaboration. To have interprofessional collaboration, the students to be prepared through interprofessional education. So basically, we need teamwork to achieve our goals. Yeah. So, for example, here in Universitas Indonesia, at the cluster of health science, we have Faculty of Medicine, Faculty of Dentistry, Faculty of Public Health, Faculty of Nursing, Faculty of Pharmacy. As you can see in the picture there, that this is the building that our undergraduate students are learning together in this building. And we have about 15 credits where our students studying together to do interprofessional education. So in the health science cluster, we prepare the rector's degree, that's it's responsible managing facilities, managing multi-professional, interprofessional learning activities that involving around 900 students from 5 faculties, managing the finance, and also managing the human resource or affiliated faculties. So it consists of staff representative from each faculty who are appointed by the dean, and this team will report to the health science cluster dean forum. So these are the philosophy of the integrated curriculum development in health science cluster. So basically, we need effective and efficiency of research of resource to use. So this is the steps for the development when we develop the curriculum. So we map the competency, and then we decide the number of courses with its workload or credit hour system and semester. So this the 3 kinds of professional competency, which involves common competency, interprofessional collaborative competency, and also individual professional competency. So there are some interlocking shared areas where our students can learn together. So we develop multi-professional modules and also some cognitive, psychomotor, affective. We use the various kind of approach, which includes multi-professional module learning, interprofessional module learning, collaborative students, and extracurricular activities. So these are the curriculum structure of study programs. So we have university compulsory courses and cluster compulsory courses, and also study program compulsory courses with some topics such as ethic and legal area, basic medical biomedical area, and also communication area, collaborative health time area, research, and also disaster management area. So in conclusion, the future population is expected to be a major driver of increasing the demand for multidisciplinary services. Delivery of healthcare in primary care will therefore require more and high levels of interdisciplinary teamwork or interprofessional collaboration. Thank you very much. I hand back to moderator. I cannot hear your voice. Ooh.
Check.
Now we can hear your voice. Now we lost your voice again.
Really? For ending your session, I want to give some highlights points about the presentations. The first one is about the mega trends around the world, including global